Now, our anchor leg will be run by Larry Sperling, the new Executive Director of the Million Hearts Initiative. We are very excited to have Larry here for one of his, I think, first presentations as the new head of Million Hearts. Dr. Sperling has a really distinguished biographical sketch and a great record of leadership in cardiovascular health. It's all in detail in the program book. So without further ado, I introduce Dr. Sperling.
There we go. All right, thank you, John, for the introduction. And Tim Atterbury introduced himself as the new CEO of FACC, and he said he's been there now for 14 months. My role in Million Hearts is not quite approached 14 days, but it has really been an exciting and wonderful ride already for me. It was really fantastic to hear your inspirational and outstanding work here. So many highlights, and I've learned a lot. The work going on at Ohio State, amazing, and I look forward to hearing about the football game with 110,000, and I hope Ohio State pulls through too, because they're having a great season. So sincere thanks to the National Forum for this opportunity to address you all this afternoon to provide a Million Hearts update. On behalf of the dedicated team that I've had a chance to now work with for a couple of weeks, and the valued partners, I counted in the program here, there are 26 Million Hearts partners included under the National Forum members. And so those of you who are not yet Million Hearts partners, we encourage you to work with Million Hearts because it's kind of the core of what we've been focused on here today. And I'm honored to serve this critically important initiative. Many of you are familiar with Million Hearts 2022. It's co-led by CDC and CMS, and you're aware of its goal to prevent 1 million heart attacks and strokes in the U.S. over a 5-year period. There are 3 foundational pillars of Million Hearts: keeping people healthy, optimizing care, and improving outcomes for priority populations. Again, themes that resonated through the day today in all of our discussions. Million Hearts, if you're not aware, is one of the 6 winnable battles. It's been designated one of the winnable battles by the CDC. And a winnable battle is a public health priority where significant progress is possible in a short time frame. Million Hearts started in 2012, and it's provided a core roadmap for cardiovascular prevention, including resources and tools to be used across the spectrum of health promotion and disease prevention. I'd like to highlight some of the exciting things that are going on with Million Hearts, and a lot is happening with the Million Hearts initiative. If you haven't yet looked at or downloaded the Tobacco Cessation Change Package, this is a program that has been developed in partnership with colleagues in the Office of Smoking and Health, and it's a quality improvement tool offering a change package for both outpatient, inpatient, and behavioral health settings. In the program today and about to be launched is the Million Hearts Hospital and Health Systems Recognition Program. And this allows hospitals and health systems who may already be doing things in the space of heart health and cardiovascular prevention to be recognized for their great work. And as it's outlined in the program there, you would have to satisfy at least one strategy in at least a minimum of 3 of 4 areas: keeping people healthy, improving outcomes for priority populations, and optimizing care, and lastly, innovations for health. Our goal will be to onboard, this will be looked at on a quarterly basis, with the first deadline of applications likely being January 31st, 2020. And our goal is to onboard at least 50 hospitals and health systems in the first quarter. Coming soon will be Million Hearts and Municipalities Toolkit. This is focused on local communities and allowing local communities to contribute to Million Hearts, to become part of the initiative, but importantly to focus on what's going on in their local communities, so to individualize their initiatives and focusing on those they serve closer to home. I've heard a lot of amazing things here today that are going on in the arena of cardiovascular health, cardiovascular prevention, and trying to focus on preventing heart attacks and strokes and cardiovascular events. The panels we had here today were really, really phenomenal. There was open and honest dialogue, and we learned a lot. I do think we can prevent heart attack and stroke. This, though, is urgent. We've heard about the urgency. Betsy Thompson showed the most recent map of what's going on across the U.S. in those who are 35 to 64. And so this emerging wave is upon us. Importantly, though, to impact this winnable battle, we need collective action and partnership across the sectors of health and healthcare represented here today at the National Forum. We must absolutely focus on impacting and improving cardiovascular health, identifying and comprehensively treating populations at risk, implementing proven strategies and innovative health systems interventions. I thank you again for inviting me to the forum. I look forward to, if I haven't met you today, I look forward to meeting you individually, hearing about your organizations, and most importantly, we look forward to partnering with you and your organizations focused on the goal of preventing 1 million cardiovascular events, because this clearly is the core of our mission, and it is the center of all of our hearts. So I thank you for the time this afternoon, and I look forward to working with the National Forum and the organizations here today. Thank you again.
Dr. Sperling, do you want to take a couple of quick questions?
I'm glad to take questions, and I absolutely will do my very best with any questions, comments, or thoughts.
All right. I think that that affirms that you did a great job of presenting.
All right.
And
well, thank you.
And I'll stay there for a moment, Dr. Sperling. When Janet Wright let out the word that she was moving to the office of the Surgeon General, my first thought was, poor Betsy Thompson, because now she has to find somebody to fill these giant shoes left by Janet. And I think so many of us in the room have appreciated Janet's great leadership of Million Hearts, getting it off the ground, being such a great leader for all of us and getting us engaged. And then as I've had conversations with many of the people in the room, just informally, the next thing that always came up was, pity the poor person who will have to follow Janet. And when you were announced, Dr. Sperling, I immediately heard from people as the word got out. First, Dr. Thompson did it. She pulled off what we all thought was impossible. And second, from people who know you, who've worked with you, whether through the World Heart Federation or ACC, ASPC, a lot of these organizations where your leadership has been so important and so dynamic, universal support, acclaim for the choice. So congratulations, Dr. Sperling. And thank you for including the National Forum annual meeting in your initial lap.
Thank you. And again, I'm not trying to fill Janet's shoes. She and I have had some great conversations. I know these were big shoes, and I don't look good in heels. She was always, dressed to a T. But my goal as a leader is easy. It's to serve this critical initiative and to serve our American population, because we have a concerning situation here in the U.S. and we need to do everything we can to prevent heart attacks, strokes, and cardiovascular events. So I thank you for all of your support and kind words. Thank you, John.
Thank you for your leadership.